Good evening, everyone. Good evening. Can you hear me? Hello, everyone. How are you? Hope you are doing well in your preparation. But just need you to mention about the date of your exam. First of all, I'm Dr. Ibrahim. I'm a lab 2 coach and instructor. In this session, we will conduct a mock test. We will not discuss station or explain anything, just a mock testing. I will choose from the attendings to do the mock, to do the station, and I will explain the exact approach for the station after it, okay? And from the start, just please, people who had exam very soon should practice, and other people should give them the space to do that, okay? So can you write down your test date in the chat box? Okay. 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 So what about others? Before starting, like usual, I will give a general advice about this exam. First of all, I conduct Black 2 courses, Black 2 mock session, one-to-one mock, personal private mock, and these 3 sessions nearly every week. Okay, every Sunday, the new time will be 5 p.m. UK time. Okay. Um, this exam is not a difficult exam. It just an exam needs you to know how to tackle this exam, to know the exact approach for the whole exam itself and for each station separately. Okay, so to know the correct approach, and actually the correct approach to be a good doctor, to be natural. Okay, not to be scripted, to be organized in the exam. Okay, to be relaxed. All of these are important points. Like deal with the exam day as it is a day in your clinic, in your hospital. All of us, or most of us already had a specialty in their home countries, or even have done the internship here. So it is like a day in your in the hospital or in a clinic. Deal with the whole situation like this. Okay, it's very important to do so. You hear a lot from a lot of people, academies notes, a lot of your friend. You shouldn't be scripted in the exam. And I think most of us don't know what is the meaning of scripted. Scripted is to assume like the answer depending on your notes. Like because they are a little bit classic in the GMC, so they bring the same station again and again and again. So you might see the same station that you have seen in your notes, or one of your friends told you about it. Okay, so actually you have a whole idea about this station. Okay, so you depend, you show the examiner that you do depend in you, on what in your mind. I mean by that, without asking the patient enough question, you assume the answer. Actually, I usually say you should be scripted, but you should show the examiners that you are not scripted by asking relevant question. Ask relevant question related to the station, okay? And please don't assume the answer, okay? And also, one of the most important point for this exam is to manage your time. Try to manage your time. Each stage, each session, I say that. manage your time, especially the history time. From my experience with doctors, the most common cause for not passing this exam is a long history time. Okay, for that, I need to illustrate. We have two types of history in this exam: a focused one, focused short history, and a detailed history. The detailed history will be in a medicine station, which is the first presentation, mostly the first presentation of the patient, and you should analyze the presenting complaint and put some differential in your mind and ask about this differential. Okay, so it is a detailed history station. You have to ask a lot of questions. So you have to be quick, organized, and prioritize your question in this medicine station. And a focused history station, which might not take about 2 or 3 minutes. Okay, just I'm asking to the point questions that will help me to explain the result of the test, or will help me to manage this patient. Okay, so I don't need to ask him all the question from the scratch. Just imagine he came before and he has been asked all this question, so no need for it. Okay, put this into your consideration. That's it. Let's start. I will start sharing. I will start choosing some people. Dr. Amna. Dr. Amna, can you do this station? Is it possible for you?
Is this the second?
Okay. So just before starting, people in the exam, you will have 1.5 minutes before entering the station, like in front of the cubicle, and you will have a copy of the station. You have to read this station in the 1.5 minutes and try to think about the diagnosis or which station is it, and to think about some question you should ask in the start. Okay, after that you will enter the cubicle again, look at the ceiling, to the camera, mention your name and your GMC number, and after that sit in the chair, introduce yourself to the patient, and start the conversation. Okay, so we will try to simulate what happened in the exam, and I'm trying to simulate what actually happened as a role player in the exam from the question to many doctor. Okay, are you ready, Dr. Amna? Okay. Who else want to do the station? Just put a comment on the chat box. Okay. Sorry, Dr. Amna. I should unmute you, right? Okay.
Hello?
Yeah.
Yes, I will read it now.
Yeah, okay. Read the station. Are you ready?
It's just a second, sorry.
Take your time.
Yes.
Should we start?
Yes.
Okay, it will be okay.
Yeah. Hello? Hello.
Hello.
Begin. Please enter the room.
Hello, my name is Dr. Amina, one of the junior doctor in the department. Is this John Bernard?
Yeah, I'm John.
Well, is it the correct time to call you?
Yeah, it's okay.
Mr. John, sorry. Would you please confirm your full name and full address, please, and date of birth?
Yeah, I'm John Bernard, and I was born on 5th of February, 1975, and I live in 5 George Mark Street.
All right, John, just to let you know, if in case the line drop, is it the number that I have to call you on it?
Yeah, it is my only phone number.
Well, John, I'm here to tell you the result of the test that you have done before. So before discussing your result, I would ask you some questions that may be related to your condition. Is that all right for you?
Okay.
Well, may you tell me, like, why did you do this test?
Actually, I noted some swelling on my body in the last 2 weeks. It was painless, but it spread all over my body. So I went to the GP, and he mentioned that we should do this test.
All right. Were you having fever at that time?
No.
All right. Any weight loss?
No.
Any cough or flu-like symptoms?
No.
Any decrease of the appetite?
No.
All right. And do you have any medical condition?
I think I'm always fine.
All right. Do you take any medication, including the over-counter drugs?
Sometimes I took paracetamol for headache, but not regular.
All right. How about allergy? Are you allergic to any medication?
No.
All right. Any family like any one of your family is having a medical condition?
No.
All right. John, I want to ask you questions like it's really related to your condition. Are you sexually active?
Doctor, what condition do I have?
No, according to your blood result. So I'm having the blood result with me. So I will ask you question related to this blood result in order like to understand the background.
Okay. Yeah, I'm sexually active.
All right. And do you have a stable partner?
Yeah, I'm married.
All right. Do you use, by any chance, like for the last few months, did you have any other sexual partner apart from your
Is it
husband?
important to answer this question, doctor?
Sorry?
Is it important to answer this question?
Yes, please, because it's very important to tell you the result. So it will give me a good idea and a background about the blood result test.
Yeah, I was in a business trip recently, and I had a casual relationship with someone.
All right. Did you practice safe sex? I mean, condom.
Actually, no.
All right. And when was that, please?
It was about maybe 3 weeks ago.
3 weeks ago. All right. All right. So how's your relation with your wife? You told me you are living with your wife.
Actually, we are a very lovely couple. We don't have any problem.
And she is supportive as well.
Yeah, she's very supportive.
All right. So before, like you have, so according to the test result we have done, all of the test results they are normal, except for the HIV test. It was positive. I'm sorry to tell you that.
So what do you mean by that? Do you mean I'm having AIDS?
Well, I'm not saying you are having AIDS because we have to do further investigation, but your HIV test is positive, so we have to do further investigation to know if it is to know there is something we call it CD4 count, and we have to calculate to know the count of this cell in order to say it is AIDS or it's HIV. Because and for the AIDS, like it will take time, but we have to measure these tests. So I will I will discuss that with my senior in order to do a further investigation. How do you feel about that? Are you
Doctor, are you sure about this this result? From where I got this HIV?
Yes, I'm quite sure about the test result because you have told me you have been on a trip recently and you have done unsafe sex. So maybe it transmitted through this sexual relationship. I'm
But
afraid.
I asked her before doing that.
Yeah, maybe.
She
2 minutes
mentioned that she
remaining.
doesn't have any sexual transmitted infection.
Maybe she was not aware of her condition. Maybe.
Okay. So what
Yes.
should I do right now?
Well, right now, I would first of all, I would recommend you to tell your partner because you know it's a sexual transmitted disease, and I know that you are caring about your wife, and you told me your relation is good, so I think it's better to inform her so she will not have the disease as well. What do you think?
I can't do that.
Can you tell me why you don't want to tell her?
Because yeah, directly she will think I'm cheating on her, and it was only one time, but she will not understand that.
Please try to convince her because I'm sure that you love her and you don't want her to be in harm.
I
And
can't do that. Don't push me, please. I can't do that.
well, it's all right. You know, we have a notification program in our system, and it is we can't tell her the name, but we can advise her to do the test. Anonymous program. Do
She
you
will
think?
come to know it was because me.
But we will not mention your name as I've told you.
Actually, I'm her husband. So yeah, it will be very clear for her that I'm cheating on her and I give her this infection. I think there's no need to do that, doctor.
Well, John, it's very important to tell her, and it's our duty, like a doctor, also to tell her because it's a
Yeah,
serious.
I promise you I will do a safe sex.
Even so, like if you do,
Move on to the next
Thank
station.
you, Dr. Amina. Thank you.
thank you,
Well done. Thank
thank you.
you. So yeah, after well done. This station is a very common station. Okay, it came a lot in the exam, and it usually came like a telephone call. Okay, it came for many doctors. This is some sort of counseling station. So people, before doing each station, let's put some rules. Is it a counseling station or a medicine station? This is the first question. It is counseling station. So is it a long history station or a short history station? It should be a short history station. This is like a direct question in our mind. We should ask it to ourselves, okay? So this is counseling about test results related to HIV. So first of all, I will confirm the identity of the patient, as Dr. Amina did. Introduce myself at the start. I should introduce myself. Before entering the cubicle, I should know if I'm calling or the patient is calling, okay? And after that, I should explain to him why I'm calling today, like about the test result. And after that, I should ask him some questions that will help me to explain the result or to manage, okay? What is the most common question that one should ask in a counseling station related to test result? Okay, everything is in the note, but I should ask the missed point. The first missed point here is the progression of the presenting complaint. I usually comment on this. the progression of the presenting complaint. Like he came before because he had like a swelling lymphadenopathy in his body. So the first question that I should ask after why you did this test in the first place should be, how is the swelling right now? Is it increasing? Is it decreasing? Like any associated symptom? So I should comment on this. It's not a medicine station. Yeah, I can ask other symptom that is related to lymphadenopathy, like fever, like any other type of infection. But I just need you to put into your mind that he already diagnosed. He already diagnosed. Okay. So actually, we excluded other causes for that because we have done many tests to exclude that. Okay. So now I know before entering the cubicle that he is HIV. So in my mind, I should think that I should exclude all the risk factor for HIV. Okay. Like one of them is sexual relationship, unprotected sex. Okay. Another one could be people put other situation in the chat. Just write a comment on the chat. Other causes for getting HIV could be like tattoo, like blood transfusion, like IV drugs. Okay, like doing a surgery recently. Okay, like from the workplace itself. Okay, so I should put into my consideration this differential, and I should cover all this differential. Why? Because actually in the management, I will tell him, don't do that. Like if it is unprotected sex and he keep doing it, I will give him advice. If he's a drug abuser, I will give him advice regarding that. So I should ask all differential regarding to the risk factor for HIV. So first of all, explain, illustrate why he did this test. After that, ask about the progression of the presenting complaint, and after that, ask risk factor for HIV. So I can see that the family history is not important here. Psychosocial, even it's not important in such a station. I don't mean it is not important, don't ask it at all. But if you don't have the time, please exclude it because the management needs more time. Okay, like the CD4, mentioning the CD4 count, people, one of the most common problem for us as a doctor is that we usually do practice with our colleagues. So if you mentioned to me CD4 count, I will know about it. I'm assuming I know about its immune cells. Okay, but the patient doesn't know about these medical terms. So I usually advise to use the patient's own language. Okay, we will measure the CD4 count instead of saying that the immune cells or it could be AIDS, or we need to see the progression by measuring the immune cells in your blood or some sort of immune cells in your blood. And after that, yeah, say it is CD4 count. Okay, I don't know, but believe me, I have done this station many times before in my mocks with a lot of doctors. But usually female doctors start with tell your wife. They choose to continue or to give the whole time for tell your wife. Actually, wife is not the primary patient here. People start the management, but usually males, they start with, I swear God, I have noticed this many times before. I don't know why. So start with the primary patient, who is the patient himself. What you will do for the patient? You will refer, you will treat, you will speak about the treatment option, you will give him some life advice like a self-help measure, and after that you should come to the wife. Actually, they are very automated patients. If you start to argue with him about the wife, he will waste the time. You give him the chance to do that. So the typical arrangement, I would tell him about the result. And in the exam, the usual role player who came to many doctors, he was not caring. Like some people try to make it as a breaking bad news, and it should be a breaking bad news. But he directly asks, is there any treatment for it? He didn't give a shit for the whole situation. Is there any treatment? No or yes. Okay. So I would tell him the diagnosis. I would tell him from the I had the test result with me, and it showed that it came back positive for HIV. Like, I don't think this is my own approach. This is my own approach. I don't think it is irrelevant to tell him or to make him happy, and after that to make him sad. Like, it came back negative for 1, 2, 3, 4. Everything came back normal except for HIV. Oh my God! It shouldn't be like this. I need the HIV to be negative and everything to be positive, no problem. Okay, so I don't think it is the most appropriate way to tell him the diagnosis. Or it is very easy to tell him, it shows that you are HIV positive. Okay, and HIV is a well-known infection or a well-known condition to the public. Okay, so you don't need to give more illustration. If patient, doctor, can you repeat the initial part again, please, as in how to identify if the patient is calling us or... Okay, this is a very good question, people. Okay, we have many stations today, so we need to finish all of them, and we have 2 hours. Okay, so just to finish the management here. This is the diagnosis. Does he have AIDS? Actually, AIDS is a stage, and it is the latest stage of HIV. Okay, till now it is HIV. We have to do more investigation, as Dr. Amina said, to see the stage, and it could be an early stage. Okay, but we can't give a definitive diagnosis about that. Okay. He will be referred. He will be referred to get the treatment. He will be referred. Okay, and the treatment, people focus on this point. The treatment will be a combination of a retroviral medication. Mostly, the most common regimen is a combined tablet. He will take it once a day for the whole of his life. Okay, so the treatment for HIV should be for all the life. Okay, but the point is, after 6 months, yeah, he might reach a viral load that can't be transmitted to anyone else again. So the treatment should be continued for the whole life, once a day, but the viral load, the amount of virus in the blood should reach its minimum after 6 months, which means it can't be transmitted to everyone. And actually, we will do regular screening for him. He will do regular screening. Okay, he will measure the viral load from time to time and the CD4 count from time to time. Okay, to see the effectiveness of the treatment and to see the progression itself. And if he stopped, he might start from a new medication, because this might develop a resistance to a medication. But actually, you don't need to say all these sophisticated details. Just mention about the referral, and just mention about the treatment itself, that will be done, and after that you should mention about the wife. You can't push the patient to tell the wife, but she had the right to know about this condition as the patient. Okay, but you can't push him, but she had the right, and you need to tell her by yourself if he didn't want to tell his wife. Regarding to the question, how can I know if I'm calling or the patient is calling? Okay, it will be very clear in the exam. It will be very clear that the patient is calling to know about something, or you are calling to tell. The 2 situations are different. If you are calling, you will start, I'm calling today because I need to speak to you about 1, 2, 3, 4, 5, 6. Okay? Or if he is calling, how can I help you? Very easy. Okay? Sometimes he is calling to know the result of a test, and you know that. So he will say, I know that you are calling to know the result of your test. Can we have a little chat before starting? Like this. People, everything is clear. I'm sorry if I gave anyone like a detailed or a harsh feedback. It is for your own sake. Any question in this station? Who need to be next? No, you should convince him to tell the wife. You should convince, oh, okay, I'm sorry, I forgot to give an advice about sexual history. The most appropriate way to ask sexual history, the most appropriate way, first of all, in not only in this station, but in any station that include something related to sexual history. So are you sexually active? Do you have a stable partner? Do you have a stable partner? In this condition, I might ask, like you might signpost, I'm sorry to say, do you have any other partner recently? Okay, he might say yes. Okay, how many partners did you had in the last 6 months? So are you sexually active? Do you have a stable partners? Any other partners? How many partners did you had in the last 6 months? This is what is important for us in the last 6 months only. And what is your sexual preference? He might say, I do sex with men and women. People, it is very important, and it is like a golden point that might give you more marks in the management. You know, for homosexual people, I want you to go and check the NHS. Those people do a screening from for HIV, as I remember, I think every year. Okay, so they are at risk to have more infection. Okay, so go and check for it. So what is your sexual preference? What is your sexual route? Okay, have you ever been diagnosed with any sexually transmitted infection before? Do you practice safe sex? So it should be like this, a detailed sexual history, because it will make a big difference. Okay, Dr. TQ. Just a second. Yeah, unmute yourself, Dr. TQ.
Hello.
Hello.
Yes.
How should I address you?
Yeah, Khulud.
Okay, Dr. Khulud. So you have 1 minute to read the station. There's
Okay.
nothing in the station actually.
Yes.
Should we start?
Yes, please.
Okay.
Begin. Please enter the room.
With Clement GMC number 7765739. Hello.
Hello.
This is Maria.
Yeah.
Well, my name is Khulud, one of the doctors here in the GB department. So, Maria, before we start, would you please confirm your full name, date of birth for me?
Yeah, I'm Maria Watson and I'm 28.
Okay. So, how can I help you today?
Doctor, I came today because actually I'm planning to get pregnant, and I'm very concerned that I might get a baby with cystic fibrosis.
This is really valid concern, dear, and you did the right thing coming here. And may I know why are you concerned about that?
Because I had a sister who had this cystic fibrosis.
Oh, okay. And is this the disease runs in families? Do you have any other children with the same condition? Do you have the same condition, or any of like your husband?
I can go to your question. I think I don't have the condition, but my mom passed away 10 years ago because of some sort of cancer, and they relate this cancer to cystic fibrosis.
I'm really sorry. I'm really sorry about that. You've told me that your sister is diagnosed with cystic fibrosis. Is this right?
Yeah.
Okay. From what you have told me, I came to know that you don't have any symptoms of the same disease, right? So it's only your sister.
Yeah, I think so.
Okay. Any condition in your husband family?
I
Same
don't know
condition?
about the.
Okay. So have you experienced any symptoms like abdominal symptoms?
No.
Okay. During have you attended your sister during her during her condition? Can you tell me about what she was suffering from?
Actually, she suffers all the time. She had this recurrent chest infection from time to time, I think she had
Yes.
tummy problems too. She had problem with weight, something like this. And sometimes she is good, and sometimes she had a bad days. You know, it is not a curable condition. That's why I don't need to have a baby like her to suffer like her.
Yes, yes, I do understand. I appreciate this. Is really a valid concern. Well, since you've told me that this condition, you don't know if your husband has the same condition or not, so you don't go through any investigation for your husband as well, right?
No, we didn't do any investigations.
Okay, okay. Okay, dear. So let me tell you about this. Cystic fibrosis is a very common condition that runs in families. However, you might have the condition, but you don't have any symptoms. So you want to make sure that if you do have the symptoms as well or not.
So do you mean that I could have the problem, but doesn't cause symptom, or what?
Yes, yes, yes. Sometimes, yeah, you might have the disease. However, you don't have any symptoms. So we call this in this case like you are a carrier of the disease. So you can transmit it, but you don't show any symptoms.
Okay.
Okay. So since you've told me that you didn't go through any investigation for yourself or your husband, so first we need to check that. Okay.
Okay.
Okay. So do you want me to tell you how you'll be going through this further?
Yeah, sure, yeah.
Okay. So let me ask you, do you have this your first child that you are planning for, or you do have any other children?
Yeah. No, the first one.
The first one, okay. So basically, we're gonna do a genetic testing for this condition. It's called Sifter gene. We'll be checking for this gene if you have in your blood, you and your husband or not. Okay.
Okay.
Okay, and there is a condition that you might have like you don't have the disease at all in your blood. This means that there is no chance for your son to have the condition, to have the disease, your born one. However, there are some conditions that you might have the disease in your blood. However, you don't show any symptoms, and in this case, we have so many options to avoid transmission of this condition to your born baby.
How to avoid that? So do you mean I might have the disease, but I will not transfer it to the baby?
Yeah, we have some options to avoid that.
Like what, doctor? Can you tell?
Okay, yeah, I will tell you now. So actually, we can do for in vitro fertilization. This means that we will choose an ova or an egg from you. It will be completely healthy egg, and then we'll do fertilization outside in the lab, and then we can put the healthy egg again in your body, in your womb. Okay, in this case, we choose the healthy egg that doesn't carry the gene of the disease.
Yeah, this is a
You
brilliant
understand?
idea.
Okay, we do have other options as well that we can test.
2 minutes remaining.
We can test your child once you have him in your womb, and then we take a sample from him to see if he do have the disease or not, and we can carry this further.
Do you mean abortion?
No, do you want abortion?
No, I didn't get your point. How we will carry after testing him if he got positive for
Yeah, if
the
positive.
cystic fibrosis?
Yeah, this
Yeah.
disease is actually it is not curable disease. However, we can manage the symptoms. So after you give birth to your baby, we can manage his symptoms, and we can follow him from day number 1 in his life.
No, but I don't need to reach this point.
Oh, okay. This what I understand as well. So how about we start first with doing the test for you, the genetic testing, to see if you do have the disease, the gene of the disease or not first, and then we can, if maybe actually the child doesn't need anything at all. Maybe you're free. If you are free, your husband is free as well. This means that the child will not have the disease.
Okay.
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 Okay. This is only, let me make it clear for you. This is only the disease will be transmitted to your child if you are a carrier. If the disease, since you've mentioned to me that you have no symptoms, in this case you are a carrier or you are completely healthy. This is the only case.
Okay.
Okay.
Yeah. Okay. Thank you.
Do you have any other questions you want to discuss further?
Will I be able to do abortion if I go to baby with cystic fibrosis?
Actually, abortion is, you have the right for that.
Move on to the next station.
Okay. Thank you, Dr. Khulud.
Mhm.
Well done. Well done. You asked nearly all the question, but it was not arranged as it should be. Like we should do arrangement for the steps, okay? And also like you are too quick, so I just need you to make sure that the patient is following you up. Okay, you should check the understanding from time to time. Don't assume that the patient, people, all of you, don't assume that the patient in this exam might tell you, doctor, I'm not following, I'm not understanding. No, he will lose some marks from the IBS regarding this without talking. You should check the understanding. You should check the for everything from time to time. It is not an oral exam. You didn't came to give like the medical concept or the medical information. No, it is two-way conversation. It is just chatting with the patient himself. Okay, because this is avoidable mistake in such exam. Okay. Also, this station especially is a little bit confusing. Confusing how to do it, how to make it simple. It is one of the most easy station in Blab2, but still it is very confusing for many doctors. And I'm sorry to say, a lot of doctors fail this station in the exam. Okay, so what is the exact approach for this station? First of all, she came asking about cystic fibrosis. Like Dr. Khulud mentioned, why do you concerned about cystic fibrosis? Because my sister had cystic fibrosis. So now I should reflect. People, whenever you have the chance to reflect on the patient, do that. It is a mark from the IBS. I'm sorry for your sister. They like this reflection. I'm sorry for your sister. How she's doing now. Change the tone of your voice. How she is doing now. Train yourself to do that. Okay. So it is supporting and gaining information at the same time. She might mean that her sister is a carrier. Okay, so I need to ask, like Dr. Claude asked about the symptom, but this is in the first part of the station. So I shouldn't ask her a question and come back again to ask another question. No, it's just one shot. Okay, so how is she doing? How does she cope? Which symptom does she have? So I will ask her such a question. And after that, directly, anyone else in the family had cystic fibrosis? So if she mentioned about the mom, yeah, mom passed away because of cystic fibrosis. So most commonly, this girl, our patient, okay, Maria, she should think about herself at least one time before. So I might ask her, have you ever been, and what about you? Have you ever been diagnosed with cystic fibrosis? Have you checked yourself before? Do you know about, now I should signpost, like give a signposting. Signposting is important. People, whenever you are about to ask some symptom to exclude a medical condition, you should give a very clear signposting. I'm asking you this question to exclude this medical condition. Like I should ask, do you know about the symptom of cystic fibrosis? I might ask, do you have any of them, like recurrent chest infection, like a cough, like tummy problem? No. Okay. What about your husband? This is the next step. What about your husband? I just need to ask one question. Does he have any symptom of cystic fibrosis? Or he ever been diagnosed? No. What about his family? Does he have any family history of that? No. That's it. This is the only history I need to ask to be able to answer her concern. Okay? Because I know that a lot of people make it like it's a prenatal counseling. He will mention about that in the station. He will mention if it's a prenatal counseling or it's just a counseling regarding this in cystic fibrosis. Okay? So if you have time, you can ask whatever in your mind, but make sure that you give enough time for the management. how to start the management. I should say, or I would say in this situation, I would ask Maria, how much do you know about cystic fibrosis? Okay. Yeah, this is a good question. If you didn't mention blood sister or biological sister, this is a good question. Okay, you should confirm this. Most commonly, she will be a blood sister, but is she a blood sister? Just one question, and it will be good. But because she mentioned her mother also had cystic fibrosis, so it is like clear that he is blood sister, but you should ask this question too. Okay. About the management, how much do you know about cystic fibrosis? She might mention cystic fibrosis is a disease runs in families. People, we don't need to make the situation difficult for ourselves. I mean by that, you don't need to mention complicated medical information in such an exam unless you have been asked. Don't give. It is just an 8-minute exam, people. 8-minute exam. Actually, if you had, I'm saying it again, if you had this station in your hospital, you might take 1 hour as you want, and no one will ring a bell until you move to the next station. Okay? So put it into your consideration to use simple language as much as you can to make it easy for yourself. Like, yeah, Maria, you are right. It runs in families. Okay? So for your baby to get the disease, you and your partner should have at least 1 copy of the faulty gene. If you told me you should be a carrier, I don't know, I'm not a medical student or a doctor. I don't know what is the meaning of the carrier. Unless you explained it again, and actually Dr. Khulud have done that, okay? But I don't prefer to use these words. So you and your partner must have at least 1 copy of the faulty gene, which means a carrier state. Till now, we can't know. That's why we need to refer you to a clinic. Okay, to a genetic clinic to be assessed, you and your partner. Are you okay with that? Yes. And after that, we will give a chances. But one of the most concerning chance here, it should be told after telling her all this information, because actually a lot of people enter the cubicle and just from the first minute in the station, they said, you have a 25% chance to get a baby with cystic fibrosis. You are 100% scripted. This is the chance for any autosomal recessive condition, but not for this special situation. Okay, and in any any autosomal recessive with a carrier, with 2 carrier parent, but it might not be the situation here. So you should signpost also. One of the concerning condition here is that you and your partner are a carrier. Okay, sometimes someone might have the gene causing the disease. I can't say he has the disease, but there's no symptom. But I can say the gene causing the disease, or he have the inheritance, but he doesn't have the symptom, which means he is a carrier. He has only 1 copy. Okay, I should make it clear like this. So is that you and your partner is a carrier? In this situation, you might have 25% chance to get a baby with cystic fibrosis. Okay, 25% chance in each pregnancy. Okay, make it very clear. Why? Because you will be asked, doctor, so if I'm having four children, if I go to one with cystic fibrosis, the next 3 person will be okay, will be clear? No, it's a chance in each pregnancy, 25% chance. Okay, we'll confirm it by doing genetic testing, and actually we will we might do like investigation during pregnancy itself, which is the coronavirus sampling or amniocentesis. No problem to say take a sample from the child. It is clear to her, and this will, after that we will give a comment on this. If she wants to do an abortion and you don't have the exact answer, make it easy for yourself. You can refer her to a specific clinic. She might go the full information regarding this, or you can return it to your senior instead of like giving a false information. Yeah, she can do abortion, but there is a rule for abortion. Actually, if you don't know about it, no problem. Just mention, refer to a specific clinic, or I will back to my senior, and address your concern. Okay, that's it. Who need to be next? We need a male doctor. Who need to be next? Okay, Dr. Hassan, just a second. Okay, unmute yourself. Doctor,
Yes, doctor.
yeah. Can you hear me?
Yeah, I can hear you.
Okay. So you have 1 minute to read the station.
Okay.
Ready for it?
Yes, I'm ready.
Okay.
Begin. Please enter the room.
Hello,
Hello.
my name is Dr. Hassan, and I am one of the junior doctors in this emergency department today. Can I please confirm your name and age?
Yeah, I'm Alex and I'm 62.
Okay, it's very nice to meet you today, Alex. What
Thank
brings you here today?
Actually, doctor, I had a very bad pain in my back since the last 2 days.
Okay, don't worry, we are here to help you. Are you comfortable enough to talk to me?
I will try to manage until you finish your assessment.
Okay, I would try to be very quick with that. So can you point with one finger where exactly do you have the pain?
It is in the lower part of my back.
Okay, when did it start?
2 days ago.
Okay, is it the same since it started?
Uh, I think yes, it is the same.
Okay, anything that makes it better?
No, even I tried some paracetamol and I tried 2 tablets of ibuprofen, but
Mhm.
without improvement.
Okay, anything that makes the pain worse?
I think it is worse by itself.
Okay, okay. Do you have any other symptoms?
Like what, doctor?
Like any pain running down the legs, any of your legs?
No, no,
Okay, does the pain go anywhere else?
no, I don't think so.
Okay, what does the pain exactly feel like?
It is dull pain at this area.
Okay, dull pain. So do you have any problem by any chance in urinating?
No,
Any problem in passing stools?
no,
Any loss of sensation in your back passage?
no.
Okay. So by any chance, did you lift any heavy weight object since you started having this pain?
I don't think so.
Okay, no lifting of heavy weight object. Okay.
No,
Uh,
no.
okay. Do you have any other medical conditions
No.
like any high blood pressure?
Yeah, I have high blood pressure since about I think 9 years.
Okay. Do you take any medication for that?
Yeah,
Okay. And is it well controlled?
to be honest, is not.
Okay. So have you ever thought of going to the GP to get your blood pressure checked and controlled?
Yeah, I go, but I'm not regular with that.
Okay, okay. Do you have any family history of similar symptoms?
Yeah, my dad has high blood pressure too.
Okay. I mean, any family history of back pains?
No, I don't think so.
Okay. Do you have any allergies?
No.
Okay. Do you take any regular medications apart from the paracetamol and ibuprofen?
No.
Okay. Just a few questions about your lifestyle. Is that fine?
Okay.
Can you just tell me about, do you work?
Yeah, I work.
Okay. Can you tell me about your job?
I'm a cashier on Tesco.
Okay. Is there anything else that you think might be important for me to know?
Yeah, this morning I felt some pulsation in my tummy. Like there is something is pulsating in my tummy.
Okay. Okay. Is it the first time you are experiencing this?
Yeah, yeah.
Can you tell me more about it? How does it feel like? It's pulsating. What do you mean by pulsating?
It is not like something from the bowel itself. I don't have any bowel discomfort, but I feel that something is making some pressure in my tummy.
Okay. Do you have any pain in your tummy?
Yeah, but it is not like the pain on my back.
Okay. Does it feel like any discomfort?
A little bit, yeah.
Okay. Any problem with the bowel due to this?
No.
Okay. Okay. Thank you for answering all of my questions. Now I would like to examine you. Would that be fine?
Yeah, sure.
Okay. I need to check your observations, including your blood pressure, your heart rate, breathing rate, body temperature, and oxygen saturation levels. Okay.
Okay.
And I would like to examine your tummy and your back, and also your back passage. Would that be fine?
Okay. So the blood pressure is only increased 150 over 100. The examination of the tummy, there is a pulsating mass in the tummy. Examination of the back, there is tenderness in the lower part of the back. Back passage is free. Nothing else.
Okay. Mr. Alex, have you anything in your mind what might be the cause of your back pain?
No.
Okay, so from what you have told me and from what I have examined, on the examination of your tummy, there is a pulsating mass, and I'm suspecting that you might have a condition called abdominal aortic aneurysm. Uh, have you ever heard about it?
No, what is it?
Okay, let me explain it to you. Basically, there is a large blood vessel called aorta in our tummy, and there could be there is a swelling of this vessel. That's why you are experiencing pain in your back. Does that sound understandable?
Yeah, but why I'm having this?
It could be due to a high blood pressure, but we need to do some more tests in order to confirm the diagnosis. Right now, I measured your blood pressure as well. It was elevated. So this could be one of the causes. Do
Okay.
you understand?
Yeah, I understand.
Do you have any questions up till now?
Yeah, is it a serious condition?
I can understand you are worried about your condition, but unfortunately, if it is left untreated, then it could be serious. Okay.
Okay. So what could be the treatment?
First of all, we need to admit you under surgery department. Are you okay with that?
Okay.
And then we need to do a series of blood tests, including blood tests to check the function of your liver and kidneys, and check the levels of salts. We also need to do some scans in your tummy, and then the specialist, the surgical specialist, might see you, and he would advise the treatment plan accordingly. Does that sound good?
Uh, okay. Is there any complication for this condition?
I can understand it's a valid question and you are worried about it. Yes, if it's not well controlled and treated at the right time, then it can lead
Move
to.
on to the next
Thank
station.
you. Thank you.
Okay.
Well done. Well done.
Thank you.
So yeah, you are right. It is abdominal aortic aneurysm. But first of all, people, if we had a stem like this, before starting the station, 62-year-old man having a back pain, I will tell all the differential of the back pain, okay, and we will choose from it. Back pain, it could be just a trauma. This is the first differential, just a trauma, okay. It could be back sprain. The next differential might even be this back sprain because of trauma or because of something else. Might be disc prolapse, okay, and this disc prolapse might cause some pain in the back and even cause sciatica or coda equina or something like this, okay. And because of the age group, it might be prostate cancer infiltrating in the vertebra or abdominal aortic aneurysm, okay. So we have about 4 differentials. So I should put this into my consideration. I should ask, actually, because he is old, so I should exclude all this differential, even at least one question about each one of them. If he is young person, I might like exclude only few differential, okay? But the most common 2 differential here are prostate cancer and the abdominal aortic aneurysm. The fact that he is hypertensive since the last 10 years, this supports the abdominal aortic aneurysm diagnosis. How to exclude all these differentials? Some of them will be excluded by asking a question, and some of them will be excluded by doing some examination. Okay, like I should ask in the start, open question. People, whenever you had any pain station in the exam, it should be open question. Don't choose to ask a detailed question, because if you mention just only one detailed question, you will continue the whole Socrates by yourself. Okay, so I should ask him, tell me more about this. I just need to know more. I need to understand more about this pain. And after that, I will start to ask him specific, or I continue the whole secret, the radiation of the pain, the site as you asked, the character of the pain, all of this question. And after that, any associated symptom like any tingling sensation, numbness around the back passage, tingling sensation in the leg, like any weakness in the leg, any pain anywhere else in the body. Okay, so before you had this pain, anything happened? Did you sustain any trauma? Like you asked me, did you lift in heavy object? Okay, what else? We excluded disc prolapse, we excluded trauma. I should exclude symptom related to prostate cancer and abdominal aortic aneurysm. Prostate cancer by asking, yeah, some urinary symptom. Okay, symptom related to urination might be obstructive or irritative symptom, problem in starting or stopping the stream, dribbling, like many other question. Family history, not back pain, family history might be of prostate condition or any other medical condition like a hypertension. Okay, so we excluded prostate, and after that ask a question related to abdominal aortic aneurysm. By the way, he might not mention abdominal aortic aneurysm in the pulsating mass. I gave you a direct like keyword for abdominal, but he might not mention. So at the end of the station, make it your last differential. Okay, so do you have any pain in your tummy or any discomfort in your tummy? Search about abdominal aortic aneurysm. Like, do you feel any pulsation in your tummy? But make it your last question. Don't be scripted. Okay, like this. If he didn't mention, or he might mention if you mentioned about tummy examination. But sometimes people fail this station because they focus only on the back. Okay, and they don't do any like tummy examination or back passage examination. Okay, we can do more investigation here. We can do an X-ray here. Okay, we can order an X-ray. We might order an ultrasound scan. Yeah, we will refer to a specialist, but we will suspect the diagnosis. don't build the management according to a confirmed diagnosis. It's not confirmed. We have to confirm it. We have to yeah, I'm suspecting you have what's called abdominal aortic aneurysm. I can't say this, but I'm suspecting you had this pain because of a swelling of the main vessel in your tummy, which is called abdominal aortic aneurysm. And this swelling make a compression that causes you this pain. Okay, so abdominal aortic aneurysm is not something popular for public people, but we have to confirm this. We'll do further investigation, like mini investigation, primary investigation for prostate cancer itself, which is the X-ray of the back, the gel scan on the tummy to confirm that. Will involve a specialist. And yeah, regarding to the diagnosis or the finding, it will be the diagnosis. But when he asked me, is it serious condition? I can't say it is serious if left untreated. No, about a very big number of patients who came with abdominal aortic aneurysm, we will not treat him. We'll just watch them and do a screening. Okay, it should be like a certain enlargement. I think more than 5 centimeters or something like this. You can check the NHS for that to be treated. Okay, like there is a risk of rupture of the aneurysm. Away from this, we will just watch them and do screening. So I can't, but I can say if it is confirmed abdominal aortic aneurysm, it will be according to the size of the swelling itself. Okay, the size of the swelling. Okay, it will be the management. Yeah, during the history too, I should ask some more question related to this condition, like yeah, smoking, alcohol, like weight gain, like eating a lot from outside, sedentary lifestyle too will lead to this condition besides the high blood pressure. And I should give general advice about that, because this is the only point I will do in the management, or the only management I will do. Okay, people, that's it. Who need to be next? We need to do the next station. Just write a comment on the chat. No, people don't ask me for a score. Score is done in one-to-one mock, not in public. But you did well. You did well in the station. You buzzed the station. We need to be next. One ready for the next station? This is easy station. Okay, just a second. Dr. Iro, just unmute yourself.
Hello, doctor.
Hello, hi, how are you?
I'm good. My exam is not so near. Is it okay I participate, or you have got some doctors who got nearby exam, they can try if they want?
You can participate, no problem.
Okay, doctor. I will try. I'm not very good, studied very well. I'm just going through all the sessions of you, and I'm just trying to get into it. So
yeah,
we'll try.
Actually, starting the practice as soon as you can will help you a lot.
Okay. Okay. Thank you, doctor.
You're welcome.
Okay. Can I start reading now?
Yeah, you can.
Okay. Okay, I'm ready, doctor.
Ready?
Yeah.
Okay.
Hello, my name is.
Begin. Please enter the room.
Okay,
Hello.
start.
My name is Zerum Bakar Sheikh, and my GMC number is 123456. I am the junior doctor here in the GP clinic today. Can I have your full name and date of birth, please?
Yeah, I'm Diana George and I'm 40.
That's good. How can I help you today, Diane?
I came today to know the result of my test.
Okay. I have got your results with me. Before starting a discussion on the report, can we just have a little chat? What make you to do this blood sample done? Do you have any complaint?
Yeah, actually, because I started to feel a little bit tired recently.
Could you tell me more about that? How long you are feeling that you feel tired?
It was since about 2 weeks.
Before the 2 weeks, are you perfectly fine? Are you doing all the regular activities easily?
Yeah.
Okay. And do you have any other symptoms related with that? Do you have
No, it is just the tiredness.
just tiredness? Do you have any fever with that?
No,
Any cough?
no.
Okay. Any pain in the body with this fatigue and tiredness?
No.
Okay. And so anything which make your pain worse at the start of the day or at the end of the day?
I think I feel tired all the day, but when I do any activities, I feel I'm more tired.
Okay. How is your tiring affecting your daily activities? Would you able to do your daily routine works?
Yeah, I started to be well a little bit, but I still feel tired.
Okay. Would you mind if I ask you, what do you do for a living, dear?
I own a small company, and I started even to feel tired. I think because I start the preparation for the opening of this company.
Okay, so you are feeling stressful nowadays. This is one of the reasons.
Yeah.
Okay. Are you looking after of your diet in these circumstances, or you are just ignoring it?
To be honest, I'm not good nowadays regarding to the diet and even the exercise.
Okay. And would you drink alcohol?
I drink, but it's not too much.
Okay, just like a social drinker.
Yeah.
And what about the smoking, dear?
Yeah, I smoke.
Oh, how many cigarettes?
About 7 cigarettes a day.
And how long you have been smoking, dear?
Maybe 3 years.
Maybe 3 years. Okay. Do you ever think about quitting it? Do you try to quit it?
I didn't try, but maybe in the future.
Okay, that's good to hear that you are willing to do it. We will have a word regarding this later at the end. Okay, and just a brief history. Do you have any medical condition diagnosed till now? Any high blood pressure, diabetes, or heart condition?
No.
Okay, and do any of the family have any medical condition like that?
Actually, my sister, yeah, she feels the tire, but she feels the tire all the time.
But she have never been investigated, or
No,
why?
she had I think she had some sort of anemia. They told us it runs in families. I don't remember the name.
Okay. Okay, so you do know what anemia is?
I think it is some sort of thalassemia or something like this.
Okay, okay. Actually, the thalassemia is a condition in the blood in which your blood cells carry the oxygen from one part to others. So they are the cells who carry the oxygen with them to the different parts of the body. So thalassemia is a condition in which there is a little genetic abnormality. You can say the gene is not like carrying the oxygen from one part to the other. So the cells are not as regular as it should be, and this condition is called thalassemia.
Okay.
Any of the other family member have got this condition like that?
No, I don't think so.
Okay, and what about your parents?
They are okay.
Okay, because some people presents with some complaints which shows up that they got this condition, and some people in which the condition has been masked. So there are two things which make it together. So if there's only one faulty gene, the other will mask, and you don't have the symptoms in every patient. And some patients exhibit the symptoms so that they become investigated for further. And I would suggest you, and we would like to, that we will also go for you, because the results I got with me is also shows that you got a less hemoglobin. These are, which means you have got an oxygen capacity a little bit on the mild. It's not very less, but it's on the mild side.
Okay.
Okay, so you have got routine blood samples done, but we want you to do a specific test for that condition which you call the thalassemia. Okay.
Okay.
Okay. We also might need to get some other investigations done, like the routine ultrasound of the abdomen, in which they put some jelly on the belly and they will have a look on the organs. Are they doing well or not? They might need to check iron levels.
Okay.
And then they will try to rule it out that.
Okay, so do you mean I'm having thalassemia like my sister?
You can, but we will need some other tests to check if you got these genetic faulty genes in you or not. So before having that result, I can't tell you you have got this. The only things which is concerned on today's examination or reports only shows that you got a little less hemoglobin in your blood, and one of the cause could be the thalassemia, as you told me.
Mm-hmm.
Okay, and I just want to ask one more personal thing of you, which can relate to that. Did you got your periods regular?
Yeah.
Okay, anytime you have got heavy bleeding?
No.
Okay. That's all. So do you want to ask me anything more?
No, but when I will do this test?
Okay. You just have to wait in the waiting area. I am going to have a talk with the nurse, and she is going to try and make an appointment for you, and she will guide you when you have to come, and they will tell you that we will check, and they will tell you the time when we got the results back with them. And after that we might need to send you to the genetic counseling center which they do the proper counseling to you further.
Move on to the next station.
Okay. Well done for the first time to do a station. Well done, did well.
Thank you, doctor.
Actually, you nearly covered most of the things, but just we need to do some rearrangement of the station. Okay.
Yeah.
So, yeah, from this test result, I can see that the hemoglobin is low. So in my mind, I should ask about some differentials for low hemoglobin. Okay.
Okay.
And I should also, as I mentioned, comment on the progression of the presenting complaint. She came because of tiredness, so I should comment as you have done. How is the tiredness right now? Is it increasing, decreasing, the same? And how does this tiredness affected your life? The impact of tiredness for 3 weeks or 2 weeks might affect the life, so the impact should be addressed. And after that, I should ask a more differential about the anemia itself. She had anemia. Okay. So first of all, what should come into my mind is the last thing you have asked, which is a period. How was your period? Is the first thing that should ask about. Was it regular? Do you have any heavy periods, any bleeding or spotting in between the periods? It's a common cause for that. Especially, she mentioned that she had a stressful condition, and yes, stress increased the amount of blood, causes heavy period. It could be a cause. Also, bleeding from anywhere else in the body, okay, might be the cause. Bruises might be the cause. She might have bruises in her body, and this might lead us to like, might be there is internal bleeding or something like this. So I should ask about this point. Also, past medical history of any condition, drugs, and family history. Yeah, like a family history of anemia, which is she mentioned about thalassemia. Okay, I just need everyone to put into her consideration or to be concerned about the condition itself right now and the main task right now, and after that mention about anything else. So our main task in this condition, in this station, to mention about the test result, okay, which came back positive or low for what, and high for what, and normal for what. Okay, this is the main task of the station, and after that I will come to anything else. Like when she mentioned about thalassemia, there is no need to explain about thalassemia right now, and you could have thalassemia or this point. Okay, but I can't see, or just reflect on her, or just skip the question. Don't give any comment on it. I might comment on the sister. How is she right now? Is she coping well? Does she have any complication? How do she cope with this usual tiredness? I might comment, but there is no need to comment about thalassemia before explaining the test result itself. Okay, so now I will explain the result. Okay, if I finish the history, I will explain the result. The result came back low for hemoglobin, and nearly it is okay for everything else. Also the MCV, which is the volume, like the blood cell, it is low, so it showed you have anemia. Okay, the serum iron is normal, serum ferritin is normal. Okay, so I excluded the most common cause of anemia, which could be iron deficiency anemia. The fact that you mentioned that your sister had thalassemia, so we might need to do testing for you also. Okay, but if she had thalassemia like her sister, homozygous for thalassemia, or have this gene causing the disease, she will have thalassemia all the time. But he might have just a small thalassemia, like a triad from thalassemia, which appear on a stress. Okay, so she will be okay all the life, but in the stressful conditions, she might have this tiredness. Okay, so I shouldn't scare her, or I shouldn't tell that she will be like her sister. Just I will explain the result of the blood test, and after that I will mention what we will do next for her to manage the whole situation. I might give her some advice related to stress. She have to eat healthy diet, to do regular exercise, just a general measure for the patient. Okay, that's it, people. That's it for today. I hope you got the ultimate benefits from today's MOOC, and